Okay.
Mayor, I can hear you. This is Carrie. I can hear you.
Okay, I just want to make sure we've got a thumbs up from the team that we're up and running. Okay, looks like we're good to go. So thanks everyone for your patience. I'm obviously from my home office today. And I really appreciate the media's patience and assistance. We've all learned to do this differently, and it is much appreciated. So in a minute, we're going to hear from Gary Edwards, and we're also going to hear from David Schold, and we will go to them in a minute. But I did want to take a second to update everyone on another matter. The first positive COVID-19 case happened recently at the Men's Resource Center. And we were able to get results back after a test was done. Positive results came in on Wednesday evening. And of course, the Men's Resource Center is located in South Salt Lake. And we want to thank the team on the ground there for their excellent work, their preparation, their planning in advance, the road home team, and the Salt Lake County Emergency Coordinating folks at the center, the health department. We took action quickly and have made some adjustments and want to give everyone an update on that. So as soon as the individual, and this person is over the age of 60, this person started showing symptoms, he was transported to the hospital for treatment and testing. And then since then, the following steps have been taken. The Salt Lake County Health Department initiated an investigation to assist the additional potential risk to others at the center. And we were able to send asymptomatic individuals off-site, many of them, and we're in the process of doing that. We were first identifying those that were high risk, and we have provided alternative housing at a county-operated quarantine facility. As of this morning, 24 individuals have been provided transportation and are currently housed at that facility. We are moving people throughout the day. And again, we were able to identify those most exposed and move them in the first wave and continue to work on that process throughout the day. The road home staff have disinfected the affected dorm room and the entire facility. At this point, it's not accepting any new clients, but we expect that we'll be able to shift that at a later hour, hopefully today, given we're seeing a decrease in patients there now, which of course is a good thing in terms of our ability to even provide further social distancing. Our current practices do encourage that social distancing, good hygiene, and we are, of course, continuing increased sanitation and appreciate the road home team working on that. Our advanced daily screening process will continue. And I should note that even prior to this incident, we had, of course, a plan in place, our COOP plan, and we also have been focused on cleaning techniques, disinfecting areas, additional hygiene, and some good practices related to not moving beds and that type of thing. So these protocols have allowed for the road home team, the health department, South Salt Lake, others assisting to move quickly and I think in the right way. And of course, our key concern is the homeless population. And I have to give a shout out to the team who worked tirelessly weeks ago to prepare these centers. We have several throughout the valley, and we were able, within a moment's notice, to follow the continuity of operations plans and get things taken care of. Of course, we knew, given the aggressive nature of the virus, that we would face this, and it's heartbreaking when it happens, but we are on it, and I could not be more pleased to have the road home as a partner. The health department's doing amazing work, and everyone who was involved, and we will continue to monitor this and update. And of course, we believe transparency is critical as we work through these difficult times. So with that, I'm going to get to the initial plan for today, which did not initially include that update, but felt it was important to get moving or be able to share on the earlier side of things, the situation. So I want to talk a little bit about what it means to reopen Salt Lake County. We don't see that that's imminent, but we do work towards that and are planning towards that. And as you're aware, Salt Lake County's stay safe, stay home order expires on April 13th. And this week, we will be extending that order until May 1st. There'll be no substantial changes in that order, which means that we will continue our existing restaurant modifications. We will have specific business closures, as we have already stated, those that cannot practice social distancing. Of course, we will continue to allow businesses to run that are able to practice social distancing. And I think that's a really critical point. We will continue to encourage businesses who can operate social distancing to have as many people work from home as possible to keep up and running. And of course, we've identified essential businesses as well. All of that information is on the county's health department website. And again, we will not see major changes to the order, but an extension through May 1st. I also want to say we're coordinating with the state right now and other counties. We're trying to get more consistency on our various timelines. That will be helpful to the public, as we recognize this is not simple as we move about a new way of doing business. And today, I want to now move to some context and discussion around our decision as it relates to our future step down of restrictions. I want to thank everyone for complying with stay home, stay safe. It's critical that we stay on that, but we are beginning to be able to identify where we'll go and how we'll do it in the future. And I want to bring up a slide because we've identified 4 phases to get us through this crisis, and they're very consistent with the state's plan. So want to share, we're in phase 1, and I want to talk about how we can get to phase 2. So there are 4 areas, and I want to just take a second. So phase 1 is the world that we're living in now, these restrictions, the stay-at-home order, really working to really encourage our partners, both in business, who have been so great, our communities and such, to continue to comply and do what is necessary as we move towards potential opening in the future. So that we are in that phase 1. Phase 2 is the opportunity to begin to lessen restrictions. We don't believe that we're going to be able to go from 0 to 100 in terms of opening. We're going to have to do it in a phased way. And then phase 3 is with our into the future, that point in time where we will be able to open up fully with some modifications. I think everyone realizes that this pandemic is creating a new way of doing things in the future, and we will be part of our world conversation, our national conversation, our state's conversation about what we will do. And then the 4th phase is really the work that will be done in the months to come, the years to come, as we prepare in a different way, with the hope that we don't have to face a pandemic like this, but the realization that we're living in a very different world now. And so we will be, throughout these 4 phases, of course, acting in a different manner with each. But that 4th phase, I think, is important to at least know is out there, and to be able to document what we're doing well and how we can change things going forward. So with that, I also want to have us discuss 4 key areas to consider as we move from phase 1 to phase 2. So our team has been hard at work at the command center, and we are well aware that we are seeing some level of stabilization thanks to the stay home, stay safe initiatives and people complying. I'm proud of our state. I'm incredibly proud of our county residents for the work they are doing in this difficult time, and it is working. We know that. We've seen that news nationally as well. Welcome, Puddles. One of the challenges of working at home. She's very friendly, but she likes to say hi to bikers who go by. So give me a minute. Yes. Oh, there she is. You're a celebrity. Everybody meet Puddles. She wants to say hi. Okay, back to work. Okay, go find Daddy. Okay, back to, I feel like my dog just became an internet celebrity or something. So our continued decline of cases is really critical for us, and David is going to take a minute. I should probably get out of here as quickly as possible and turn this over to David. Milestone 2, we want our hospitals to run well. Stay with me. Okay. Number 2, of course, we're paying attention to the efforts of our hospitals, their attention to emergency supplies, their identification of respirators and other key items that are so necessary, and their capacity as we see our hopefully more of a curve than a steep number of cases. Milestone 3 is testing everyone with symptoms. We're doing that now. People who need testing are able to get testing, and Gary can address that. And then 4th, of course, is able to conduct monitoring of confirmed cases and their contacts. And our health department has hit that one out of the park, is doing a great job. And we're continuing to see people who have a health background volunteer, go through the state system. So our contact tracing is very, very strong. So I can share that we're in really good shape with 3 and 4. All right, well, now that we've handled the attempt of working from home with a video conference featuring Puddles, I'm going to turn it over to David and the team and see if while they're doing that, I can find somebody to take care of my dog.
Thank you, Mayor. Good morning. My name's David Schuld, spelled S-C-H-U-L-D as in David, and I am the Intelligence Section Chief for Salt Lake County's COVID-19 response. The Intelligence Section has developed local trajectories that are informed by actual data that is gathered on a daily basis here in Salt Lake County. During last week's briefing, I provided you an update on the trajectory of total confirmed cases in Salt Lake County and how we all play a vital role in lessening the spread of COVID-19 by practicing social distancing. Today's message is just as important as the last. I want to talk today about where we would have been and where we are going to be with your help. And the graph is up. Great. As of yesterday's reporting, there was a total of 832 total confirmed cases of COVID-19 in Salt Lake County. Without social distancing measures that we are urged to practice every day, we could have hit that same number of cases on March 26th, roughly 2 weeks ago. With that same model, we could have been between 1,490 and 2,230 confirmed cases today, had we not begun practicing social distancing. We would have seen more hospitalizations and more fatalities. Social distancing is working and is effective in limiting the spread of COVID-19. We all play a role and we are all contributing. Please help us, help your family, your friends, your community by continuing to practice social distancing. You will see from this graph that the curve of total confirmed cases is flattening. While we do see an increase of cases, we are also seeing that rate of increase stabilize and lessen in its acuteness. We are seeing the estimated number of individuals recovering from the virus increase as well. Let's stay the course. These next 2 weeks are critical. This is our counteroffensive to the virus. The Intelligence Section continues to monitor and work with partners from across the medical systems, the county, and the state. If we see a sustained decline of cases and hospitalizations, we will be in a better position to make tactical and concerted decisions that allow Salt Lake County to return to a new normal. Please help us with this effort. I will now turn it over to Director Gary Edwards of Salt Lake County Public Health Department.
Thank you, David and Mayor Wilson. And thank you to those of you who are participating in this, this briefing. I am Gary Edwards, Director of the Salt Lake County Health Department, and I'll be visiting for a few minutes about testing and monitoring and the important role that these play in our efforts to continue to flatten this curve and begin to return to normalization. We all know that testing was slow to be rolled out, and there were limits on who could be tested at the beginning. But fortunately, through the efforts of many in this state, including public and private sectors, testing is now available, and we don't seem to ever max out the number of tests that could be available in a given day. And so we encourage individuals to seek testing. Individuals who are symptomatic with cough, with fever, with shortness of breath, I urge you to go to the coronavirus.utah.gov website, find a testing location that would be close to you, make that contact, and set up an opportunity to be tested. We have been seeing more individuals tested, and as more individuals are tested, we're certainly going to see more cases. That's just going to be a natural outcome of more testing. The really positive thing is that the positivity rate of tests, the percent of tests that actually are positive, has remained the same at less than 5% for those tests that are done in Salt Lake County. That tells us that the virus is not spreading faster. We are just able to identify more positive cases because there are more tests available. Now I'd like to visit about an important factor in the whole public health response. Even before we had a positive case in the state of Utah or in Salt Lake County, the Salt Lake County Public Health Department was already conducting investigations. Anytime an individual was suspected of having COVID-19 and was reported to us, we began an investigation. That's something that we do anytime there is a disease outbreak. This investigation includes identifying suspect and confirmed cases, and then making sure that contact is made with those individuals to identify those that they may have come into contact with. So this has been going on actually since January. It has certainly ramped up as the number of cases increase. So this is just a natural course of how things progress in a disease outbreak. Once an individual is identified as being a positive case with the disease, they are instructed to be isolated until the disease runs its course. Those who are close contacts of that individual are also notified of that contact, notified that they have had contact with an individual who is a confirmed case, and they are instructed to quarantine for 14 days. So these measures, with the other measures that have been implemented, such as the closing of schools, promoting teleworking, closing dining areas, and the whole focus of stay safe, stay home, all of the social distancing combined with these four items that have been identified here today are critical. Now, there's still some things that we need to be doing. We are encouraging anyone as you go out for essential travel to a grocery store, to a pharmacy, please use a face mask, a face covering. Directions for these can be found in numerous sources online. Many have been doing very well, staying home and staying safe. I want to again emphasize that our 20 to 40-year-old population in the county still has more cases than we would expect them to have. We need this age group to please do your part. Employers, do not allow sick employees to be in the workplace. Everyone, if you do not feel well, please stay home. Please avoid holding or attending family gatherings this Easter weekend. And again, if you need to go out, please use a cloth face covering. Let's all continue to make a concerted effort over the next 2 weeks so that we can continue to beat this thing down. Now we'll be available for a few questions. We'll first go back to Mayor Wilson for questions directed to her.
Would have been okay. Well, I want to share with you that we'll try and keep Puddles from photobombing again. She's now being taken care of, and a few weeks ago I would have been horrified by that, but now that I'm used to Zoom meetings and everything else and connecting with you all from home, I'm guessing that many of you can relate. It's just the new world we're living in. I do want to emphasize social distancing is working, and I think those points were just made by Gary and David. Salt Lake County will continue to make evidence-based decision. We are focused on data. We are looking at real-time data now, and we've come a long way in terms of our platform, and that the information that we get through David's work and others will put us in a good place going forward. Our objections are clear. They continue to be to save lives, to preserve our community health, to support and protect our hospital system from being overrun, and fundamentally to get us back and running here in Salt Lake County and in our state and in our nation as quickly as possible. And I'm committed to that. I'd like to bring up our last slide and focus on a couple things. We are now, as I mentioned, extending our stay safe, stay home order through May 1st, and are coordinating with other counties and the state and trying to get a little more aligned where possible, where we have various counties with health orders. We're working through that. And we additionally are hoping to continue the great partnerships that we have. We're committed to that with our state, with other community members, with our counties, with our cities. That partnership and coordination is all the more important going forward as we look at joint connection opportunities. The business community stepped up, supporting the state in many things, us at Salt Lake County. That partnership and continued coordination is a priority of ours going forward. And we are planning for a gradual reduction of restrictions. That is important, that we see some hope and that we're prepared. We don't want to be flat-footed as we see data go our direction. So that planning is in place, and we're going to have even more to say about that in the next week or so. And then I want to just close before we go to questions by impressing upon everyone the continued importance of vigilance in this effort. We have to stay at it. any slip slows us down. And it's important that we continue to move forward. So thank you to the community for that level of commitment that we're seeing in so many places. So with that, I see my first question. There was news coverage earlier in the week about an extension going through Memorial Day. What has changed? Well, I think what was reported and the headlines from many news outlets, both broadcast and in the papers, wasn't as clear. What I was saying is one method for expanding dates further would be the long date and then you pull back and rescind. Another option is 2 to 4 weeks at a time, or what have you. And we chose to align with other counties and hopefully the state and looking at just over 2 weeks on a shorter term. We will follow the methods that were outlined earlier for future extensions, repeal at the point that that's possible. But we are choosing now to go till May 1. So that's that. What has the virus done to the county budget and budgets of cities? Will you have to make cuts? Well, the short answer is the news is not good. We have seen revenues decline in the same way businesses are impacted or were impacted with their own households. We're seeing that impact in Salt Lake County. On the good side is we are seeing federal funds to take care of the current costs, our expansion of our health department, our emergency management operations. There are a lot of things that are going to be reimbursable. So we will be and are in touch with the federal government. We're urging some flexibility from the federal government for the ceiling of funding that has been allotted to Salt Lake County so that we can do more in terms of expanded efforts for community impact. And I think that's really critical, is that we have some flexibility, and we're very hopeful. And we've asked our congressional delegation to help us with that best as possible. But we have a hiring freeze at Salt Lake County. We have other methods to control spending going forward right now. And we appreciate our partnerships at Salt Lake County with other elected officials and our great staff on that. Okay, there's a question if we know of any confirmed cases among the unsheltered homeless population. I'm going to kick that one to Gary. I do not know of any. I will share that we have regularly moved the homeless population to quarantine, and that's quite procedural now. We partner with the 4th Street Clinic, and we are going through a testing process. We're very in touch with the street population right now, has some enhanced measures, and I think Gary may know better. I don't know, but I am not aware of any confirmed cases among the unsheltered, but I'll let Gary clarify if I'm not informed on that. All right. I'm going to wait for a cue to kick it back and see if there are any additional questions. If not, then we'll kick it back to Gary and team, and I'm signing off. Thank you. Thanks for your patience. And we're committed to doing this every week, and hopefully we'll get the bugs out of the system. We appreciate it.
In response to the question about homeless individuals who have been impacted by this disease, we've had 2 that have been positive. One had a location to be able to go to. The other has been put in one of our isolation facilities. It appears that we have no other questions. We again appreciate you participating with us in this media briefing, and we look forward to the opportunity to share good news with you next week. Thank you.